Balance and gait abnormalities after concussion reflect impaired postural control and are assessed through postural stability, coordination, and ambulation. The Modified Balance Error Scoring System, or MBESS, quantifies balance performance and is included in the SCAT-6, the Sports Concussion Assessment Tool version 6, which is used within the first 72 hours after injury, as well as the SCOT-6, the Sports Concussion Office Assessment Tool version 6, which is designed for office-based assessment beyond 72 hours. Testing is performed barefoot or in socks on a firm surface. Orthopedic injury and fatigue should be considered when interpreting performance, and balance testing should not be performed in patients with a lower extremity injury. The modified BESS consists of 3 20-second stances performed in order, with eyes closed and hands on hips: the double leg stance, the single leg stance, and the tandem stance. Errors or deviations from the proper stance are counted during each 20-second trial. Each error counts as 1 point, with a maximum of 10 errors per stance. If the patient cannot maintain the position for at least 5 seconds, assign the maximum score of 10 errors for that stance. The total modified BESS score ranges from 0 to 30. A lower score indicates better balance and fewer errors. Errors include moving the hands off the hips, opening the eyes, stepping, stumbling or falling, lifting the forefoot or heel, abducting or flexing the hip beyond 30 degrees, or remaining out of position for more than 5 seconds. If multiple errors occur at the same time, only one is counted. With the feet together, hands on hips, and eyes closed, assess the ability to maintain this position for 20 seconds. Assess single leg stance on the non-dominant foot. Have the patient stand on the non-dominant foot with the opposite knee flexed approximately 30 degrees, maintaining hands on hips. Then instruct the patient to close their eyes and maintain the position for 20 seconds. Position the patient in tandem stance with the non-dominant foot behind the dominant foot and hands on hips. Instruct them to close their eyes and maintain the position for 20 seconds. In addition to static balance testing, gait should also be assessed. Both the SCAT-6 and SCOT-6 include timed gait with a stopwatch as part of this multi-domain assessment. Ask the patient to walk heel to toe in a straight line for 3 meters, turn 180 degrees, and then walk 3 meters back. This establishes a baseline walking time for comparison when a dual task is introduced. Errors may include stepping out of line, separation of the heel and toe, or needing support from the examiner or an object. Up to 3 trials may be performed to establish a consistent baseline. Next, assess dual task tandem gait by asking the patient to repeat the walk while performing a cognitive task, such as reciting the months of the year backward. This task increases attentional demands and may reveal deficits not apparent during single task testing.
December, November, October, September, August, July.
As part of the SCOT-6 assessment, compare this performance to the baseline timed tandem gait. A decline in speed, stability, or coordination with the addition of a cognitive task may reflect impaired cognitive motor integration after concussion. These findings should be interpreted alongside balance testing and monitored over time.